Health promotion, effective communication for nurses during the prenatal and labor and delivery process using cognitive learning theory. The purpose of today's teaching plan is to have an experienced nurse teach a student nurse how to use effective communication during the prenatal and labor and delivery process. Effective communication fosters a strong sense of support in mothers and their partners, which has been proven to lead to positive health outcomes. Our goal is that the student nurse will be able to know the difference between effective and ineffective communication techniques and know how to apply them with clients planning delivery. We will be using cognitive learning theory, which focuses on the internal processes of the learner, which includes perceptions, thoughts, and ways of processing information. Since the student nurse has just finished her communications course in her nursing program, she will be able to direct the learning process by organizing information on what is already known. We will meet our goal by reviewing key objectives and factors influencing teaching and learning, using a lecture format to cover 3 effective and 3 ineffective communication techniques, using role play to demonstrate use of effective communication techniques in a clinical setting with mothers and their partners. The first scenario is during a prenatal communication, specifically during a birth plan. The second scenario is during a labor and delivery. Following each scene, the experienced nurse will evaluate the student nurse and give feedback on how to improve communication, and concluding with the overall effectiveness of the teacher as described by the student in a post-teaching questionnaire. By the end of the teaching session, the student nurse will identify 3 strategies for effective communication with mothers and their partners, identify 3 strategies for ineffective communication with mothers and their partners, and be able to demonstrate effective communication techniques with mothers and their partners. Readiness of the learner. Since the student nurse has just finished her communications course in her nursing program, she already had positive learning experiences with this topic and was highly motivated to put these skills into clinical practice. In recognition that these skills can be difficult to apply, the nurse broke down the material into 2 different clinical situations and covered the differences between effective and ineffective techniques. Active listening, a changing, interactive process where the nurse hears the client's message, interprets its meaning, and provides feedback to the client regarding the nurse's understanding of what they just said. Focus open-ended questions. A question that is open to interpretation and cannot simply be answered by yes, no, or any other one-worded response, but places limitation on the topic addressed. Clarification, a strategy designed to aid in the understanding and message of the client by asking for more information or elaboration on a point. Moralizing, expressing your own values about what is right and wrong, especially a topic that concerns the client. Giving advice, making a decision for a client, offering personal opinions, telling a client what to do, using phrases like should or if I were you. False reassurance, using pseudo-comforting phrases in an attempt to offer reassurance.
So now that you've reviewed the concepts, let's put them into practice. Do you have any questions for me before we start?
No, I think I understand them all.
Okay, great. I will let you take the lead in there, but by all means, know I am right here to offer you any support that you need.
Okay, sounds good. So I understand that you're in the midst of planning for a baby, and that's really exciting. Do you have a birth plan or given it any thought?
Yes, I know exactly what I want, and this is my birth plan actually right here.
Okay, great. Can you tell me about your ideal birth?
I'd really like to have a natural birth with no drugs. I'm really scared when it comes to drugs, and I really would like to avoid them.
It sounds like you're determined not to use drugs. Could you tell me a little bit more about that?
I'm just scared to lose control of my body. I've had friends that have talked to me that they've had C-sections and how there's been complications with losing feeling down there, and I just don't want a C-section and I don't want to lose control.
It sounds like you've heard some bad experiences and that's causing a lot of fear and anxiety. Would you like to talk a little bit more about that?
I don't think there's anything to talk about. I mean, I think it's obvious she was only using drugs.
And we do want to support your goal of not having medications for the birth, but we just wanted to talk to you about how you're feeling and possibly answer some questions you might have about medications.
It's really important to me that I don't use medications. It's not just that it's better for the baby, I just really don't want to lose control, and it's scary enough as it is.
can definitely be a scary experience, especially for new parents. But there are different medications, though, that require you not to lose feeling, such as epidurals, or there's also nitric oxide gas or narcotics, and they won't cause that kind of result of you losing feeling.
Okay, I'm still not sure about it.
We want to support you in your goal, but we just want you to be prepared during labor with all the information possible. Having medication free for birth is definitely a realistic goal. But sometimes some people find it, the pain too difficult to cope with, and medications are useful to get through it. I will give you some of these pamphlets I have here that I brought. Just want to take a look at them, just in case you want to know any more information about the medications there for you.
So you said that there's some medications that wouldn't make her lose feeling and maybe wouldn't cause complications.
Mhm.
Can you tell us a little bit more about that?
Yes, so there's narcotics like morphine or nitric oxide gas is used, and it can be really effective. They are considered relatively safe to both mom and baby.
Okay, well, you've given us the information, so I think we'll go home and we'll do some research, but thank you very much.
You're
for all the
welcome.
information.
Okay, awesome. So earlier you said that you really didn't want a C-section. Do you think you could tell us a little bit more about that?
Yeah, I really want to have the baby naturally. I really don't want to have any medical interventions whatsoever. And again, I really don't want to lose control.
Yes, it's understandable. Having a baby naturally is the best way.
Well, I mean, there are many ways to deliver, and one way is not necessarily better than the other. But if what you want is a natural birth, we will try to accommodate you in every way that we can.
Sorry, that's what I meant. C-sections usually only happen during medical emergency. They try everything first before rushing into a C-section.
Well, that's good.
Let's talk a little bit more about how you're feeling about the labor.
Okay, so Alex, let's talk about the conversation and interaction we just had. How do you think it went?
I think it went really well. I tried really hard to actively listen, and I think it was really effective to assess their understanding from the beginning, just to kind of stay on track. And I used validation and open-ended questions, which produced a really positive effect, and they really opened up to me.
You're exactly right there. You validated the patient's thoughts and asked many focused open-ended questions, which seemed to make the patient feel very comfortable and open with you. Although you employed great technique throughout this interaction, we still need more practice. Let's talk about the conversation around the C-section. When you said that having a baby naturally is the best way, you were moralizing, and this implied that having a C-section was wrong. It is very important that during therapeutic communication we focus on our patients. This is their time to open up to us. Although I know it can be hard sometimes, we need to make sure that we're not giving any of our own ideas or personal opinions during this conversation, because it could portray to the patient that we disapprove of their opinion, especially if it's opposite, and this may lead them to change their mind. And this can mean that they would do something we both know that they don't necessarily want, or lead them to feel self-conscious or foolish about their feelings.
I didn't even realize that I said that, but you're right. I see how it can be a bad effect. And I definitely need more practice. Next time I'll put more effort into keeping my opinions to myself.
I'm sure you will. Our next couple is Stephanie and Stan, and they have decided that they want to have a natural childbirth without any medications. First, they want to try comfort measures to help with pain. See, it says here that they are open to pain medication if they need it, but they don't want you to ask them. They want to tell you if they need it.
Okay, sounds good. So I won't ask if she's in pain. Instead, maybe I can ask an open-ended question like, how can I help you right now?
Exactly, just feel it out, look at her nonverbal signs, but also keep in mind her partner. If she looks like she's in a lot of pain, her partner may also know her better than us, so just feel out the situation. We might be able to help her in other ways too.
Hi, Stephanie and Stan. I'm going to be your nursing student today. I'm Alex, and this is my clinical instructor, Tara.
Hi.
So you're going to have the two of us today.
Hi.
It looks like you're in some pain. Did you want to try something different?
What do you think?
Okay, so maybe on the next contraction we could try something like changing her position a bit with the birthing ball maybe?
We tried that earlier. It seemed to work.
Okay.
Yeah, let's try that.
Sure, I've read a lot about the birthing ball. This will definitely make you feel
Okay, well, Stephanie, first we're just gonna see how it feels for you, okay?
Okay,
Stephanie, how does that feel?
better. Let's just do this for a bit.
Okay. Okay, it's not looking like this is working. I think that we need to change position. Let's try.
Stephanie, how do you think this is going?
Not so great.
Do you think we should be trying something else?
I don't know what to do anymore. This pain, it hurts.
Do you want to try to slow dance with me?
Isn't that what got us here in the first place?
Yes, but it might help.
True. Okay. I'm just gonna move this out of the way here. Oh! I can't take it anymore. Screw it. Give me the meds.
Okay, I can do that. Are you sure this is what you want?
Are you sure? We can try the ball again.
You don't know anything. Give me the meds.
Okay, I'm just gonna go get the anesthesist, and it could be a while until it happens.
That's
Would-
okay.
Would you like to be read?
Yeah.
Okay. How did I do?
You did very well. I was really impressed with the technique of clarification when she asked for medications. You knew that they didn't want drugs unless absolutely necessary, and they wanted to ask for them themselves. You continued to keep the conversation open, leaving room for the request. And when they finally asked, I think that clarifying was a good technique. It gave Stephanie a chance to hear what she had requested and digest what it really meant. How do you think you did?
I think it was good, although I stated my opinions again, trying to give advice. I didn't even realize that I had done it until you cut in to correct me. I was also really glad that you cut me off when you did during the birthing dialogue. That could have been possibly gone really bad if I finished my sentence and told them that it definitely could have worked, and then if the birthing ball hadn't worked and hadn't relieved the pain, it could have been a bad situation. And giving them false reassurance and not having successful turnaround may really upset a patient, especially under this kind of pressure.
Yeah, exactly. And why do you think this was an ineffective technique?
I remember from our conversation earlier that I shouldn't be giving my opinions. By giving advice based on my opinions, I'm betraying on the patient that I don't agree with what's happening. Even though it may have been obvious to me that the particular position wasn't working, it could have been doing the trick for the patient. I should have just said, how do you think this is going? By asking, I did not impose my own opinions, which left the patient feeling in control of the situation. And by focusing on the labor situation, I kept the conversation where it needed to be.
You're on the right track for sure. Let's recap what we've learned today. Can you tell me the 3 effective strategies that we included in our communication session today?
Okay, well, we used open-ended questions a lot. I think that they are quickly becoming my favorite. You can get so much from our conversation by using them. We also clarified the understanding of the patient's words, and I used the active listening by picking up on their nonverbal cues.
Very good. You're learning really quickly. Can you tell me about the ineffective strategies that were used today?
Strategies that didn't work today were giving advice, false reassurance, and moralizing. I've learned my lesson, no personal opinions. It was never really clear to me in class why some strategies work and why some don't, but now I have to put them into practice. I can definitely see why giving advice and moralizing are ineffective. The others were much better for meeting the needs of our patient.
The student nurse was asked to evaluate the teaching performance in a post-teaching questionnaire. The teacher was rated as highly effective in that she allowed the student to take the lead in order to practice demonstrating the learned skills. She made herself available in case the student needed help. She gave the student feedback on how to improve. The midway evaluation was an effective tool because the student was able to correct her behavior for the second clinical situation. And when asked about how the teacher could improve, the student stated that she was happy about the support she received, but her only suggestion would be to have more practice to perfect the skills learned.